दिसपट्ट्या आयुष्यात आम्ही वेगवेगळे चॅलेंजेस फेस करता. हे चॅलेंजेस समटायम्स आर मेंटल चॅलेंजेस आणि हे जेन्ना मेंटल चॅलेंजेस आमचेर जाता तेन्ना आयदर समटायम्स द रिपरकशन्स आर शॉर्ट टर्म ऑर लाँग टर्म. शॉर्ट टर्म समटायम्स आर क्युरेबल. लाँग टर्म जेन्ना वता तेन्ना एकदा सुसायडाचेर सुद्दां विशय पावता. ह्या अशा वेगवेगळ्या विशयाचेर आमी जाणून घेवपाक आनी मोर इम्पॉर्टंटली हे आयुष्याचे अंत न जावचे आणि हांगाच्यान खंय तरी एक वेगळी सुरवात जाते म्हणून ह्या कार्यक्रमांतल्यान ही आमी हो टॉपीक आयज चूज केला. द टॉपीक इज सुसायड अँड मेंटल हेल्थ आणि तुमी पळयता इनर व्हील क्लब ऑफ म्हापसा आणि प्रुडंट जोड पालवान तुमच्या मुखार घेवन येता अस्तित्व शोध स्वताचो. ह्या पहिल्या सिरीजान आमच्या बरोबर आसा डॉक्टर पीटर कॅस्टेलिनो, सायकॅट्रिस्ट आणि डायरेक्टर एट COOJ मेंटल हेल्थ फाउंडेशन. डॉक्टर, वेलकम टू द शो.
Yes, thank you so much for having me here.
Okay, my first question is something that everybody is dealing with. I think almost all families, the kind of stress level that has been increased in all this situation, especially when you have a situation like pandemic. Awareness about this mental health is of prime importance. What is this basically that you'd like to explain to all our viewers?
Yeah, and yes, what you're saying is right. I mean, the whole concept of mental health is so very important. I mean, if you look at all of us as human beings, our desire is to have a successful life, to be goal oriented, to earn money, to have a name, and to have some standing in society, to just feel a part of society and to feel some kind of self-respect. But all this, I mean, requires a good functioning of your mind. I mean, imagine, you spend a lot of time in the gym, you eat well, you want to look good, but that's not enough to give your personality, to give character to your personality. It is the functioning of your mind, your thought process, the way, you feel, the way you're able to process information, the way you're able to plan, your intellect, your memory, all these functions will actually help you to give some amount of character to your body and helps you to achieve your goals. I mean, time and time again we come across people who are so intelligent. I mean, in school they are A rankers, but in life they are not really successful. And the reverse, you will find people who have not really been so good in their academics are actually achieving so much in life because of that resilience, because they've set their goals, and they are kind of working towards their goals. And all this is the functioning of our mind, and therefore as much as we take care of our physical beings, it is also very important that we take care of our mind and we understand our mind. Understand the various aspects, spend time to understand this, see which are our strengths, see where our weaknesses are, build on the weaknesses, work on the strengths, and I think that will really help us to move and march forward in our lives.
Dr. Peter, I'd like to ask you one thing is, I started with saying mental health challenges. Now, most of my viewers might have objected me saying, why are you using this term mental? Why not maybe a better word like a psychological? So I feel, I just want to understand it, that there has to be maybe a little taboo in our society just to understand and maybe address this issue. Why is it so, and what is the reason?
Yeah, and I think this is such an important question because the very word mental is negatively associated. I mean, from the years of watching Hindi films or even films in general, where people with mental health issues or mental illnesses were portrayed very negatively. And it is that portrayal which is kind of stuck in our minds, and therefore we associate the word mental with something which is very negative. But as I said, mental health is something positive. We need to work on it. Where they have associated the negative connotations is when someone may have a mental illness. But again, in those years, there were so many negative aspects to mental illnesses. People thought it was due to some kind of an evil spirit, or it was something that was caused due to some family issues, and the family didn't really care about their family member, and therefore mental illness was caused. There were all these wrong misconceptions about mental illnesses, and therefore this word has stuck on into our minds as something very comical, something very negative, something very evil about it, and therefore people don't like to be associated with the word mental. But as I said, if you don't look after your mental health, you are not going to have a personality and not able to achieve all your career goals.
I remember here in Goa, especially in the early days, you would say, mental mare. I think that is how this situation or this challenge has been addressed to more importantly, and maybe nobody has taken it seriously how mental health is important in life. As a health professional, as a mental health professional, as a psychiatrist, what are the challenges that you face sometimes, especially here in Goa?
And really, this is the first challenge. I remember when we started off our association many years back, and we said, okay, we are the first rehab center in Goa, and there are almost 15, 20,000 people with a severe mental illness. And as we open our center, we are going to have a line of people waiting to avail our services. But no, the stigma was so strong. And though, I mean, I started my practice around 25 years back. We have seen a shift. People are coming out. So that is one good thing. But what I'm seeing today is more young people come out with a problem that's much more in its infancy stage. They're willing to take help. And it's their and many times the kids will tell us, please don't tell my parents, or I've come here without my parents knowing. And, because if they know that I've gone to a psychiatrist, it's all hell is going to break loose because they do not understand. And that is something which I'm really proud of the young generation today because they're willing to take help. They've recognized that there is a problem. I think these are over years of various kinds of awareness programs in schools and colleges. At a very early level, they're exposed to the concepts of mental health. So I see the stigma much lesser in younger people, but I see it still there looming around in older people, So this is one challenge that we do face.
So I think the society and the family plays a very important role, or maybe your friend circle plays a very important role to understand all this. Now, if somebody has a problem, how does one identify first, and how do you go about in getting cured?
Yeah, and it's like we have to understand that mental illnesses are very, very common. Almost 1 out of 4 people that go to a primary health setting to see a primary physician has some sort of a mental illness. But the thing is, and mostly it's a common mental disorder of anxiety or depression. But the thing is, as people, we are not really used to talking about our emotions. So we will talk about our physical problems of a headache, a weakness, a loss of appetite, sleep disturbance. And very often, if a diagnosis is not made properly, the patients end up taking out a prescription of probably a sleeping tablet or just a vitamin. And they do not get the correct diagnosis and therefore not the correct treatment. So common mental disorders are of anxiety and depression are very common, and these are the mainstay of what the kind of patients we see. Besides this, people with psychosis. Psychosis are people who lose touch with reality. A person who goes through psychosis, they probably will have hallucinations where they'll hear voices or they'll see things that do not exist, or they'll have something called a delusion where they believe things which really do not exist. Common belief systems are like where I feel people are talking about me, but actually no one is. But I feel if 2-3 people are there talking and they kind of face me, I feel that they're talking about me. Or I feel that probably my spouse or my spouse is having an affair with somebody else, when actually that may not be the truth. He's just being friendly. So we read things which do not exist.
Reimagine or maybe imagine things.
And we imagine to such an extent that we believe it. So there are a lot of people who go through troubled families and troubled relationships because either they're having a delusion, they feel very anxious. I know a couple who's going through such a huge problem only because one of the spouses has a problem called OCD, where she's very, very particular. Everything has to be kept in place. Everything has to be done proper and perfect. And if these things are not done perfectly, all hell breaks loose, and there's so much of a discord in the family. But they actually came to me saying that this is a relationship problem, but I realize it's not. It's actually an anxiety problem, an OCD problem, which is treatable. Once the treatment was given, there was so much of peace in the family. Another problem which we face are addictions to alcohol, to substances, to drugs. But more so today is the mobile addiction, which, I mean, we're all guilty of, social media addictions, gaming, eating disorders. Yeah, so there's a whole range of problems, and I think it's important that we do not simply say that these will pass away, but we need to get an assessment, check it out for ourselves, and take help on an early stage.
Okay, doctor, you kind of summarized some of the common problems as well while answering. I just want to understand is what is the kind of help that is available. Say like you have a varied, like for example, you mentioned the couple. You understood the problem and gave a solution. Things are, thankfully
Yes.
back on track.
Yes.
You have mentioned also about the mobile, which is, an integral part of every human being in now. And this addiction is at extreme level, and it will just keep on increasing maybe. So there are different kind of problems that you address. So what is the kind of help that is available with regards to, the kind of issue that you are dealing with?
So again, there's a range of services. I mean, you can either go to a psychologist. Among psychologists, you have a counseling psychologist, you have a clinical psychologist. Today, you have a whole range of people who have studied well-being counseling. So at an initial level, it's good to go to a counselor maybe, assess your problem, and if the problem is more than what a counselor can handle, then it's important to see a psychiatrist, because a lot of these issues can be medically treated. And people really ask me, this question, can medicine really change the way I think, and can medicine really change the way I feel? And I said, yes, it can, because we understand a lot of these issues also at a biological level. And at a biological level, by tweaking the levels of the neurotransmitters in our brain, we can actually help the person to begin to feel better. So there are antidepressants which will actually improve the levels of serotonin in our brain. And so once the levels of serotonin improve, the depression eases off. So I would say that it's important to tackle issues on a holistic level. From the point of counseling, and in mild and moderate cases, and in terms of even medication in moderate to severe. But I think it is important that we all learn to talk to somebody. And the initial talking doesn't have to be to a counselor also. It can just be to your friend. At a first line intervention, talk to somebody, your friend, your family, anyone who you can trust, anyone who you feel comfortable to share your personal struggles, and someone who will not judge you, who will still respect you in spite of whatever you say. So sometimes these can be through, if you don't have a family, a friend who you can talk to, call a helpline. There are so many helplines in India which are available, where you can just share anonymously, confidentially, and you'll be assured that they will not judge you, they will not ask you probing questions about your personal life, but they will be there to listen. So help is available at different levels. Depending on the intensity of the problem, we need to seek the right kind of help. Yes.
I think you've nicely summarized, Doctor. I just want to understand is, COOJ doesn't require an introduction here in Goa. COOJ Mental Health Foundation is something that, people, almost all the Goans know, and more importantly, people have sought help as well. I just want to maybe touch a little before we go to the second part of the show, is your journey, your association, and how has been the journey of COOJ over these years?
Okay. Thank you for that question, because I love talking about COOJ, but I know. So COOJ was set up almost around, actually 20 years back. The main reason at that time was to bridge in the gap in the available services and the need. And as I said earlier, what we realized that there weren't any psychosocial interventions for people with a mental illness. The mainstay of treatment was pharmacological, was medical, and so it was our hope to actually begin to set up services that would reach out to people and give them the additional help that they need besides medication. So we set up the rehabilitation program for people with severe mental illnesses. Along with that, we set up the support groups for families who have someone with a mental illness in their families, because the burden of care is huge among them. Right now, if you see, there isn't much support that a medical doctor can give to the families besides. In fact, there's nothing, So the families need to understand what they are going through. They need to understand the challenges, and they need to talk to others and identify and see, where they can get the support from. In 2014, we started, in 2012, we started off the suicide prevention program, again realizing that the rate of suicide in Goa was much higher than the national average. And that itself has been a journey. We set up our helplines, we run a lot of training programs, conduct a lot of workshops, and that.
Doctor, I just want to intervene. Is you have this dedicated suicide prevention program now.
Yes, yes.
Before we go deep into this part of the issue, I want to understand is suicide is something that is it a that thought maybe which comes to you in that few seconds and then you decide, or is it a collective thing that takes you towards that decision and you end up giving your life?
Yes.
What is this basically? I think people would like to know about it.
So it's definitely not that thought that you get. I mean, that is the final thought, but it is a collection of circumstances, the collection of different factors, I would say. And it could be an internal factor, like your own personal coping mechanisms may not be in place. Maybe you have a mental health issue. Maybe the environment is not really conducive to you kind of actually coping with a problem. Maybe the environmental factors are too grave that really your ability to cope with that may not be sufficient. Maybe you do not have a support system. It could be the taboos of even talking about suicide, and there society has a huge role to play. I mean, very often we feel that if someone talks about suicide, they're weak. And if an intelligent person, a person who's really doing very well in their studies, if that person talks about suicide, we'll say, come on, what it is. You can do it. You've always done it. Why are you undermining yourself? Why are you talking about suicide? Are you crazy? So we underrate it. And one of the reasons we underrate it is because we ourselves don't feel comfortable to talk about suicide. Till a few years back, suicide was considered as a crime, so people didn't feel comfortable to talk about it. People, in still many communities and religions, they possibly would think of it as a sin. And therefore, because of various factors, sometimes people are not comfortable to talk about it. And even if they are comfortable, maybe these signs are not really picked up. So, as you said, there are people who plan their suicides, and yes, there are impulsive suicides also, but again, the impulsive suicide is after there's a build-up over a period of time, or maybe your personality is not able to handle it. So, yes, it could be both ways.
I think the only solution is to talk, and more importantly, listen. I think these two words can change a person's decision, as he build up towards maybe the end of life.
Yes.
You also, I just want to take that dedicated suicide prevention program. How necessary is this? And in your journey, how has it changed people's life? Just maybe a number or maybe an incident.
Possibly, I will not be. I don't give numbers because just the helpline alone is not enough to reduce the rate of suicide. It's too complex. But what we have seen is that when we started off our program in 2012, people were really apprehensive to even utter the word suicide. Whenever we went into schools and colleges and into institutions and we asked them, can we conduct a suicide prevention program? They said, see, you conduct a program, but please do not use the word suicide. So that whole myth about when you talk about suicide, you're putting an idea into someone else's mind who actually didn't think about it, remains a myth. But for many people, they actually believe that we can't talk about it. This is a taboo. This is a shush. Put it under the table. But it's happening, and we are losing so many young people to suicide. I mean, in this the normal statistics go that almost one student loses his life to suicide in our country every hour, which works around 9,200 students dying to suicide every year in our country. And if you look at any college, I think a college roughly has 1,500 to 2,000 students. So the student numbers of 3 to 4 full colleges dying to suicide in our country is alarming. With our during this pandemic, the numbers increased. We do not have the facts, but from what was reported in the media, we know that the numbers increased because the normal coping mechanisms were curtailed. People were stuck at home. They couldn't move out. If you got angry with your father or your mother, you couldn't just walk out. You had to stay inside and you had to deal with it. Many could not. Many did not have that freedom to just meet their friends. So their normal coping mechanisms were curtailed, and we lost a lot more people. So what I'm saying is people are actually thinking of dying. dying and they're actually dying and doing it, it is a problem, and we cannot hide it under the rug anymore.
We have to address it.
We have to address it, and we have to talk about it.
Doctor, I just want to ask you one more thing. When you say suicide, it is a build-up towards that particular thing. As you mentioned, it is maybe sometimes it is impulsive, sometimes it is not. It's a build-up basically. I want to understand is, can you prevent a suicide, whether it is talking over this course of time and maybe changing somebody's thought process, and maybe if at all that is the last moment that you have.
Yes.
Can you make a difference in somebody's life at that particular the moment?
Suicide is definitely preventable, and when we look at prevention, it is at multiple levels. So at an individual level, if someone is having these suicidal thoughts, yes, he has to talk, he has to get an assessment. If at that last moment he's still, he's undecided and he does not know what to do, I mean, just calling a helpline will help. Calling someone who you trust will help, because what happens at that time, it diffuses the situation. It helps you to begin to look maybe at the positive side of your life. Maybe at that time, because your vision is tunneled, you're not able to see options, you think that suicide is the only option, but there might be something which you didn't think of, and when you reflected with somebody else, those options begin to build up, and you begin to feel a little bit more hopeful. That is at a talking level, but yes, many people who have suicidal ideas also have a mental illness, and therefore they need probably medication, maybe sometimes treatment more than medication, hospitalization. If it is too severe and too intense and just talking is not helping, they need more intensive treatment. But I would like to even bring your focus to prevention at a whole at a universal level, what our country can do, what our state can do, because suicide prevention is everybody's business. So it's right from the laws. Like, in fact, today we were just talking about how bridges have become one of the means to suicide. So just protecting the bridges, something as simple as in the Bori Bridge, when we had our program, the suicide prevention awareness program in Ponda, and subsequent to that, they put in these railings on the Bori Bridge. That reduced the suicide rate on that bridge to zero, which was almost like a hotspot. So something as simple as structural changes to a bridge can make a whole difference. Enforcing our laws. The Goa Poisons Act ensures that people who are underage, or basically they ensure some regulations to the sale of poisons. So just ensuring that law and that act is kind of enforced will actually help to reduce suicides. The chemists, the sale of medicines, of benzodiazepines, the sleeping tablets over the counter should not be done. And so again, enforcing those laws will actually help to reduce the rate of suicide. Ensuring that there are counselors in schools and colleges. In ensuring that people have access to treatment, to mental health care, and that they do not have to travel distances to a tertiary hospital, but they can get these services at their doorstep at primary health centers. So basic changes in our system can go a long way. The reporting, the way I would like to say this on TV, but the way media reports suicides, not really exaggerating it, but using a suicide to actually teach people on ways in which they can help themselves, and giving them access to help and support. So just the way things are reported can make a huge difference in saving lives.
Basically, the small changes is what matters at the end of the day to change somebody's perspective, maybe change the perspective that suicide is all about.
And I think for our state of Goa, I think we need to have a suicide prevention policy so that there is a dedicated team that would work towards this. Because as I mentioned, it is everyone's business. It's not just the health department, not just the social welfare department. It's a collaborative effort.
Okay, I want to ask you one more thing. We meet a lot of people. You meet a lot of people who come to you for help. Is there a way to identify that a person is going through some dilemma, so that maybe some kind of a warning signs maybe, and if that person is at risk of maybe committing suicide, is it possible to understand this phenomenon?
So the warning signs, I would say, for any mental health problem first, would be someone there's a change in their mood. They're beginning to feel more sad or more anxious, or they're losing interest in their daily activities, or their daily activities are becoming too hard for them. Something that was pretty easy for them is becoming a little more difficult. There's a change in their sleep habits, in their appetite. They're probably eating more, eating less, or just getting very irritable, or beginning to believe things that, just the whole world, your overall worldview is changing, and you're having difficulties in your relationships. I think then you need to take help. In terms of suicide, some of the warning signs will remain these, but also if the thought of dying is coming into your mind, it's persisting in your mind, it comes, it goes, it comes and goes, we need to talk about these. We need to talk if there's a sudden increase in the level of alcohol consumption or drugs, or probably there was someone who's not drinking before but now is drinking. We need to take that seriously. If someone is writing out their will, and writing a will is good, but out of the blue suddenly he decides to keep all his affairs in order, and he's kind of preparing himself, he's giving out his prized possessions, things that he treasured, he's suddenly giving it away. These are big red flags, and I think we need to take it seriously.
Okay, one more is responding to someone for basically help, who's maybe thinking of ending his or her life. How does one deal this situation?
So as I said, the first thing that the person may do is start talking about it, and we have statistics show that almost 80% people who have attempted suicide have actually spoken about it to somebody, but they probably will not speak about it in a direct way. They probably say, what's the point of life? I just want out. There's no point living. Kind of things around it. And when we hear this, we need to take that seriously. We need to ask them, what do they mean by this? And when we ask this question, and we need to ask it in a way where that person will feel not judged for even thinking that, where he will know that when we ask this question, it's because we really care about him, and we are not there to kind of put him down. And so it's very important how we ask this. But if we ask this question, we will know to what extent his problem is. See, if we don't know the problem, how can we deal with it? Then if he says, yes, I actually want to end my, or he may say, I want to end my life, but he may just go around the fringes, and then we can ask him directly, are you really thinking of dying? Is that on your mind? And people find it very difficult to ask this question, but this is one of the biggest suicide prevention tools that we have, to ask the question directly. If the person says no, okay, but if he says yes, then we need to ask further questions. We need to know whether he's got a plan, whether he's got the means to execute that plan, whether he's decided on a time, a place. We need to know all this, so then we can respond. So if he has the means, then we take the means away. If he's got some poison, if he's got anything he's got, we take that away. We keep him safe. So we draw up a safety plan with him. We ensure that he's never left alone. We ensure that that he doesn't have the access to actually complete his plan that he has thought of. And during that time, we walk with him, we talk to him, we befriend him, we understand his needs, and if it's beyond our control, we definitely take him for professional help.
Okay, Doctor, one last question in short, because I'm running out of time, is how best is Goa placed with respect to maybe other states? I know it's not a correct question, but just maybe for our viewers to understand this, how is Goa placed?
So, as I mentioned earlier, the rate of suicide is much higher than the national average. The rate of suicide in Goa is 16.3 and the national average is 11.4. So that shows that we have a lot of work to do. In fact, in India, if you see, the southern states of India have a higher rate of suicide than the northern states of India. And it's interesting because we see states that have better economies, better literacy rates, have higher rates of suicide. And one of the reasons can be because of unmet needs. The expectations are there. With education comes normal expectations, and sometimes these expectations are not met, and therefore the frustration builds up. But yes, Goa is placed at a higher level in respect to the other states of India. And again, I reiterate, we need to have a suicide prevention policy for our state, which will help us to actually tackle this problem from all angles.
I think, Dr. Peter, just to understand your viewpoint with respect to mental health, and also the most important issue that we all are dealing with is suicide. It was indeed a pleasure to understand this aspect, and I think with this program of Astitva series, I think we've made a little progress and tried to change some lives that are maybe watching. आणि जर तुम्ही हो कार्यक्रम पळयला आणि जर अंडरस्टँड केला जाल्यार प्लीज तुमच्या सायडीक जर अशें केन्नाय तुमकां खंय दिसलें आढळ्ळें आणि तुमकां जर दिसता यू कॅन बी द फर्स्ट रिस्पॉन्डंट, just talk first and then listen, and I think we can take a way out. And obviously there are institutions and foundations like COOJ who are working tirelessly to prevent suicide and upgrade our mental health. So ह्या एका पॉइंटाचेर हांव ही कार्यावळ सोंपयता. हो वेगळो विशय आमी ह्या कार्यक्रमाच्या माध्यमांतल्यान घेवपाचो प्रयत्न केलो. अस्तित्व हो शोध स्वताचो आसा आणि ही कार्यावळ आमी तुमच्या मुखार घेवन येता इन अ विल क्लब ऑफ म्हापसा आणि प्रुडंट. आणि ह्या फुडच्या एपिसोडान जेन्ना आमी परत मेळटले तेन्ना एक असोच वेगळो विशय घेवन येतले, अशेच वेगळे कोण आमच्या वांगडा गेस्ट आसतले आनी जाणून घेतले आमी खरें अस्तित्व आमचें कितें आसा तें आनी चॅलेंजीस तेजे कितें आसा. तोपर्यंत पळयत रावात प्रुडंट.